County, the first patient to benefit from UHC walked into the Nyeri Referral Hospital on the 14th of December 2018. This was after a month-long registration exercise targeting the entire population of the county. Over 700,000 residents in over 300,000 households were registered and could receive free medical services in any level 4, level 5 hospital in the county.
So it is Karatina, it is Mount Kenya Hospital, it is Mukurweini, it is Odaya, and then PGH.
But the project was not cheap. Nyeri County government received 780 million shillings from the national government for the implementation of UHC, and the county allocated 2.7 billion shillings to the health docket. 461 million shillings of the national government contribution was to be disbursed to KEMSA for medical supplies, while 319 million shillings was to be sent to the county government. Governor Mutahi Kahiga saying that this year they have received 130 million shillings and they have spent over 400 million shillings to keep the project running.
In this particular time, we might have spent in excess of about 300 to 400 million.
Data shows that there was an increase of 23% in the overall hospital visits after the launch of UHC in Nyeri County. The Nyeri Referral Hospital recording an increase of 55% in hospital visits. David Munene, a community health volunteer in Majengo slums in Nyeri, agrees, saying that they were able to convince more people to visit hospitals as they would not pay.
There was an increase of about 23% in the patient flow into our hospitals.
Tunaenda tunaongelesha community, mkiwojeka, nedeni hospitali, hakuna maripo, na wamezoea hiyo. Sasa kusikia imeisha, hiyo ni kitu imetustua sana.
For patients such as Elizabeth Njeri, a cancer survivor, the UHC program was a lifeline. She says that many people who could not afford medical care before could now visit a hospital and get treatment without thinking of the cost. Elizabeth, for example, visited the palliative care clinic at the Nyeri Referral Hospital on the 18th of March this year, and she did not pay the 1,800 shillings doctor's fee she would have without the UHC card. She was saved an additional 3,850 shillings that she would have spent on medication. Margaret Wanjiro lives with diabetes and is HIV positive. She says that the UHC came in handy as she does not have any other insurance.
We use like 2 drugs, others use 3, others use even 4. So there's some people who use 18,000, the others who use 20 something, or even more than 30.
Na pesa mtu alikuwa anatumia hakuna. Ukienda na hii alafu uende hapo nini hii kadi uangalilio uonekane unalijisti alafu unatolewa kadi. Ukitolewa kalisiti kale kanapea nago sasa unaenda kwa daktari.
This message to the Nyeri County residents has many people worried. It reads, free medical services in UHC pilot counties ended March 2020. All residents are urged to renew their NHIF to continue receiving uninterrupted care. This means that patients will have to foot their treatment costs. Some of the patients say they cannot afford to pay the insurance money and they want the government to help. The county government of Nyeri says that funding the UHC project from the county coffers is not sustainable.
And we are worried because the UHC has really benefited us. We've been going to our hospital without paying anything.
Si tunaweza kuomba tu itusaidie, itulipie tu kwa jira hatuna nguvu. Hatuna nguvu hata kidogo. Kwa jinsi tukikosa kupatia hiyo kitu watu wengi ni kukufa nikiwa mmoja wao.
The county government of Nyeri has said that residents have a 2 months grace period to allow residents to take up the NHIF cover. The patients, on the other hand, are calling for an extension by at least a year.
Because if you stop your treatment, you go back to square one. So we are worried about the patients. We are really worried. And I wish the government can pay for a 1 year for the patients.
In the next 2 months, anyone visiting a level 4 or level 5 health facility in Nyeri County will be paying for the services offered, unlike the past 14 months when those services have been free. Now, the question is whether the gains brought about by the UHC will be sustained. Martin Munene, Citizen TV, Nyeri County.